correctional psychology. Psychologists working in correctional psychology typically deal with individuals in correctional facilities. The major goals of psychologists working in correctional psychology are activities that include developing and providing treatments that focus on the rehab and reintegration of inmates, as well as the provision of treatment for a variety of psychological disorders and problems. They also help them manage stress, social skills training, or crisis intervention. Psychologists are often involved with testing and assessment. They provide information and opinions regarding security level of prisoners, information pertaining to parole and suitability for various programs such as standing trial. Psychology and law, or law psychology. This is a broad domain that encompasses a variety of activities that involve with the relationship between psychology and the court. Psychologists in legal psychology often do consultations, research, and assessment, as well as some other activities. Psychologists working within this domain might be involved in such activities as research or acting as an expert witness. They also aid in jury selection and assess the ability to stand trial. Also, they sometimes determine criminal responsibility. This list is meant to illustrate the areas that clinical psychologists work in. Differences between traditional clinical psychologists and forensic clinical psychologists are: number one, the clinical psychologist's goal is to help the patient, whereas the forensic psychologist's goal is to help the court. Number two, clinical psychologists often see patients for multiple sessions over a period of time that is often extended and not highly structured, whereas forensic clinical psychologists, however, may see a client for only a couple of sessions in a highly structured and evaluative context. Number three, confidentiality is the mainstay of the clinical psychologist and allows the freedom of exploration of issues that are extremely personal. In the forensic context, this is not so, and in fact, patients or clients are informed that information obtained from the sessions may be used against them in court. Number four, clinical psychologists normally need to know about laws and how they pertain to their practice, whereas forensic psychologists need to know about laws and legal processes that they pertain to their practice and to particular cases that the psychologists are involved with. Number five, consequences of the involvement of the psychologist differ in the two contexts. In the traditional clinical situation, the outcome of the work of the psychologist will hopefully improve the person's functioning, alleviate suffering or turmoil, and deter future relapses or recurrences of problems. Number six, with respect to treatment, the traditional clinical context involves a psychologist who is supportive, caring, and empathetic in dealing with patients and assumes that the patient wants help and will be forthcoming in discussing the personal issues. The patient, in the case of forensic psychology, is normally seeing the psychologist as a more investigative stance on the part of the psychologist. They may act neutral and detached. The psychologist also makes the assumption that they are malingering or biased, responding or withholding, and misrepresenting the truth can be distinct possibly in their responses. Moreover, the client is normally not seeing the psychologist voluntarily and may be quite resistant to the psychologist's investigation. Number seven, in research, in psychology, there are strict guidelines with respect to determine probability, and psychologists use empirical methods and results to trust findings and to determine whether particular findings are close to being established truth. This differs from trust in findings or evidence in forensic setting, whereas psychologists are trained to answer questions about behavior by gathering reliable data and obtaining valid and replicable findings. Lawyers, judges, and other legal professionals tend to use past experience, intuition, and other sources of information that have been shown often to be less than accurate. Thus, assumptions regarding trust in research findings or evidence can differ depending on the context. Forensic assessment tools. The types of instruments in this category of forensic tests were developed to assess specific legal standards or legal constructs rather than personality or psychological variables more generally. For example, tests that assess competence or a person's ability to manage his own finances would fall into this category. Relevant assessment tools would be instruments that do not focus on legal standards or clear legally defined constructs, but assess clinical issues that are pertinent to the evaluation of a person's legal situation. For example, the assessment of malingering, other response sets, or personality variables germane to criminal activity. For example, the structured interview of reported symptoms is a measure specifically designed to assess malingering. One very commonly used forensic relevant instrument is the Hare psychopathy checklist that is used to assess the assessment of psychopathy. This measure is an extremely popular instrument among psychologists. In fact, according to Otto and Hellbrom, this instrument is administered between 60,000 and 80,000 times per year in North America. This measure is a 20-item scale that is administered as an interview and assess the behavioral, affective, and interpersonal characteristics of the pathological personality style. It also includes review of written records and documents. Although developed initially a research instrument, the PCL has become one of the most commonly used measures of psychopathy in forensic assessments.